Good afternoon. Good to see you guys. This is Dr. Dawn, Chicago's own board certified OBGYN. I am here because we have got a lot to talk about. This week has been a busy weekend. I was catching the game, Cavs versus, what's our California team? Oh goodness, I'm blanking, and that's the team I'm rooting for anyway. But watching the game, and I was surfing the net, and I saw some pictures of fellow after 40 lady, and so I said, oh goodness, we need to talk about this. So that's why I'm here. Hey, Dr. Donna. So this is Dr. Dawn, Chicago's own board certified OBGYN. I am here because my mission is to empower women of all ages with pertinent medical knowledge and proactive sexual education that will optimize your physical and mental health, thereby improving the self-esteem and helping women to motivate themselves to achieve more for themselves. So, in alignment with my mission, I am going to be talking about fertility after 40, and then after that, we're going to talk about 5 reasons why you want to see your GYN doctor before 21. And there's a reason why I said before 21. Now, what we're going to do, hey, Dr. Donna, what we're going to do first is talk about fertility after 40. Because yesterday, we had lots of photos going through the internet that are showing Miss Halle Berry holding on to her belly. And it appears that Halle is pregnant. And for those of us who are past the age 40 or even past the age of 35, first of all, we know Halle has been the most gorgeous woman on the planet for the last 20 years, okay? But that does not change the fact that she is 51 years old. And she's holding on to her belly like she's good and pregnant. Not that she just got pregnant 4 weeks ago. She looks like she is at least 14, 16, I'd even say 20 weeks pregnant because she's a small lady. So she's not going to show until she's really far along. Now that is on top of the fact that earlier this year we saw Miss Janet Jackson, who delivered her baby at 50. Now, I will have to tell you guys, hey, I'm looking at all my friends joining, Miss Holly, Bobby, and Cherie. Thank you guys for joining, and tag a friend, have them join us. So, earlier this year, we had Miss Janet Jackson, who had her baby at 50. Now, I have to tell you, I wasn't as surprised with Janet because Janet is a goddess. Janet has been a goddess for the last 20 years. So, yeah, she's 50. She had her first baby, but it's Janet Jackson. So, we really could expect no less. Janet can do whatever she wants. She has ruled supreme for the last 20 years. So, if Janet wants to have a baby at 50, Janet's going to have a baby at 50. But then when Halle came on the scene, and Halle got pregnant too, and she's walking around like, no problem, guys, I'm just pregnant at 50. Then I said, okay, we need to have a discussion because I'm working on getting my practice together, but I can imagine people who are in practice that are getting a lot of phone calls as to how this is happening and how we can make that happen for them. So first, let's give some background information so that we're all on the same page and you have a good understanding of what fertility truly means. The first thing we have to discuss is how women's eggs are in their bodies. The difference between men and women are men make sperm on a regular basis. So every week or so, every 3 days or whatever, they're making new sperm. And as long as they release the old sperm, ejaculation, they then begin making new sperm. So that is one thing that we need to keep in mind. The difference is women are born with a certain amount of eggs in their bodies, and that's it. We don't make new eggs. We just have an abundance of eggs in the beginning, and we use the eggs that we have for the time period that we have to be childbearing. So let's say on average, a girl has her cycle 13, 14 years of age. That's when she starts to have a menstrual cycle, and she starts releasing the egg with the possibility of it getting fertilized and having children. Well, you may start your menstrual cycle at 13, 14, and then let's say menopause on average is 51. So that means for the next 30, 40 years, we're releasing those eggs every 4 weeks. But it's from the same pool. So if we go to the grocery store and we're trying to buy some eggs, they have an expiration date on the carton. So you look and you say, hey, today is June 5th. I don't want eggs that expire June 5th or June 4th. I want eggs that's expiring in 2 weeks because they're fresher. All right? So, hey, Dr. Lenise. So, hey, Brian. So, that's kind of what we're dealing with, and that is what can make it more challenging for women to get pregnant as they get older. They have had their eggs for a longer period of time, and what happens in the human body is cells can start to mutate, they can start to break down. So basically the eggs that are older are not as healthy as eggs that are younger. That's why it's way easier to get pregnant in your 20s than your 40s. Not saying that it's impossible, but we're dealing with some other things when you're 40 as opposed to 20. Not to mention when you're 40, you have other illnesses that can come into play. You might be overweight. You might have developed high blood pressure. You might have developed diabetes. All those things can impact your pregnancy and whether you have a healthy baby and deliver a healthy baby at the end of that 40-week period where you are pregnant. So that's why it's so amazing that someone that's in their 50 can have a baby, because as I said, the average age of menopause is 50, and menopause basically means that we don't have enough eggs present, we don't have enough estrogen present to maintain that menstrual cycle. So how do we have Janet and Hallie having babies at the time where on average women have menopause? So that's where we have technology that comes into play. And that's been the benefit for women who have chosen or for whatever reasons have their babies later. What has happened or what is an option is in vitro fertilization. That's when you take an egg outside of the body, you take the sperm outside of the body, you can fertilize them and put them back in the body. So what typically happens as people get older, what they have found is that you can take eggs, typically they will find a woman or get the woman before age 35. You can take those eggs out and you can freeze them. So you have these eggs, you're 30, 35, you don't have a partner, you're not ready to have a baby right now, but you know in the future you may want to. So you can go and find a reputable fertility specialist, and it is a surgery, but they will go in and take your eggs while they are in the ovary, take them out and freeze them. Now it's not free. Of course, you pay for this service. You pay for the actual surgery, and you pay actually to keep them frozen every year. But that's what women have the options of doing. So I haven't talked to Hallie nor Janet personally. I don't know them like that. I'm not in their business like that. However, as a physician of women, an OBGYN, I would bet dollars to donuts that when they were in their 30s or even their early 20s, they were at the height of their career, but they knew someday they want to have babies and they would have slowed down where they can do it. They took their eggs, they had them frozen to be able to use them later. The other key thing that we need to pay attention to is these women are in very good shape. Very good shape. Hallie, even though she's a diabetic, is in excellent shape for a diabetic. And Janet is Janet. We know she's a goddess. So, you know, she may put on weight and then she snaps her finger, she gets on her little workout plan and she had dropped 40 pounds in like 6 months or 3 months or whenever her next concert is. So the key is that these women are very healthy, and all of those things play a part in how women are able to get pregnant as they're older. We know that if you have medical conditions that can impact your pregnancy. So if you have high blood pressure, if you have diabetes, things like that, that can impact the pregnancy itself, that can impact your ability to get pregnant and your ability to stay pregnant. So more than likely, because these women are in tip-top shape, they probably used eggs that they had put away, frozen, and then placed them back, and then they were able to get pregnant. Now, the other option women have is to use another woman's egg. So right now, they have companies that have women, you go online and you know their educational background, you know their physical characteristics, you know their family history, you know their medical history, you know their family medical history, and you basically can kind of pick and choose what your surrogate would be. And the surrogate is basically the woman who donates the eggs. Now, that's different than a surrogate who then also carries the pregnancy, because you also can do that. So you can have a woman, she donates her eggs. Perhaps you have a partner, you use his sperm with the person who donated the eggs, and then you can create a pregnancy and an embryo. So then the next step is whether you yourself are going to carry that pregnancy or whether you're going to get another surrogate to carry the pregnancy. And we've had an example of that too. I think Sherry Shepard, at the time she was married to her husband, for whatever reason they weren't able to have get pregnant together. They got someone to donate the eggs as well as a surrogate. They used his sperm, and so they have a legal child. Genetically, that baby is not genetically related to Sherry, but they came into agreement, and legally, she's still seen as the mother of that child. So that probably is what happened with Janet and Hallie. They probably either used their eggs from when they were in their 30s and then had them placed back in after they were fertilized, or they have someone that donated the eggs and again with their partners had the pregnancy and put them back in their babies. That's more than likely what happened. But there's some steps that we regular people that are not goddesses need to keep in mind before we go that route. So I am looking at questions. Right, so Dr. Lenise asked a question. She's like, how might women in their 50s be having babies? And that you're exactly right. They probably froze their eggs, they had an egg donation, and then they had in vitro fertilization where the egg is placed back inside the uterus, and then they proceed to have, they proceed with the pregnancy to go forward as they typically do. We do have a viewer who has noted that she's had scrambled eggs, so I don't think you'd be a good candidate. But that's, that's okay. So that's how they got pregnant. But you also, before you do all this, let's say you're in your 30s or you're in your late 30s, and you want to know, hey, is it still, am I still a candidate to have my eggs removed and frozen and all that good stuff? So there's testing that you can do that will help you know how healthy your eggs are. They have what's called the AMH test, the anti-Mullerian hormone test, and that gives a good indication of the health of your eggs. So let's say you're super healthy and your past history or your mother history is something you need to, hey, Dr. Jarrett, that's something you need to pay attention to. Because there are some women that naturally, they get pregnant late and they don't have a problem. So talk to people in your family and see, okay, what's the latest that you know if somebody got pregnant? Somebody got pregnant in 43 without in vitro, then you probably genetically have eggs that are healthier. But one of the tests that are available is the AMH, where you can get that drawn and you can determine from that what the level is and whether your eggs are healthy enough to go through the process of fertilization and carrying that baby to term. Because that's the thing, you can fertilize the egg, but you want it to carry to term, and term is technically 40 weeks. 37 to 40 weeks is what we call term. So we really are looking at how many ladies, once they are pregnant, are able to keep that pregnancy to term and deliver a live pregnancy. So that's what we're looking at. So along the lines of what I'm talking about, I have a fellow doc, a good friend of mine, who actually did a whole course on securing your fertility. And in the course, she discusses different things that can be a problem with getting pregnant. If you were looking, I talked at that point about fibroids and how they can interfere with you getting pregnant. So if you are interested in looking at some of those videos and getting more information about how to get pregnant or be fertile, she has a website. It's www.secureyourfertility, just like I said, .com. and that is Dr. Jerisa Berry. She did a whole webinar on that. It was excellent. I spoke, a lot of other doctors spoke about fertility, and she talks about some of the barriers to do it. Not just being, an older mom, but also some structural reasons, some other things that can cause potentially a problem or be a challenge to getting pregnant. So, in conclusion, we are noting that even though I haven't talked to Janet or Hallie personally, I don't have their cell numbers to ask them, but more than likely what happened is they used eggs that they had frozen, and they now have a partner. They got those eggs thawed, fertilized, put back in their uterus, and they were able to carry the pregnancy to term. We also know that those ladies are probably extremely healthy, because not everybody that has a fertilized or embryo in their uterus can carry it to term, because the uterus itself has to be healthy. Your body has to be healthy in order to do that. So more than likely that's what they did. They either used their eggs from the past that they had frozen, or they have an egg that's donated from someone else that they fertilized with their partner, and they went forward with that. And there's also what you all need to know is all of this takes cash. None of this is for free. And if you are getting older, 30, 35, you want to look into the possibility of egg freezing, because you, without being a goddess like Janet, also have that option of doing it. And I would probably encourage women that are in their late 20s, early 30s to really think about, okay, do I want to be a mom? And if I do, even though the time is not right now, in 10 years, do I want to have that option? Because you don't want to be in your 40s, you finally found your partner, and now you want to have kids. That's very challenging, especially if you're using your eggs while you're in your 40s. It's not impossible. There's still some things that you can do that can improve your egg health. There's some different medications or hormones and things that they can put you on to prepare you for removing your egg. But when you're in your 40s, that drastically decreases the chance of you getting pregnant as opposed to 30, 35 years old. So if you're in your 30s or you're in your late 20s and you know you want to get pregnant, but you're not necessarily in that situation that you want to be in, then you may want to look into getting your eggs frozen. And you also want to check your insurance to see what they will cover, because some insurance companies are better than others in terms of what coverage they provide. And oftentimes when you have that egg taken out and you have it placed back in, it may not go well the first time. You may end up with a miscarriage, and there are a lot of my patients that go through the process and they have to have 1 or 2 cycles, 3 or 4 cycles before they actually are able to get pregnant. So each cycle, meaning each time they get your body ready, get your eggs ready, take the eggs out, place them, fertilize them, and even when they fertilize them, they have to choose the eggs that are the most healthy looking, depending on what, they have characteristics that they look at. They take the most healthy and they put them back in. That process doesn't always end up in a pregnancy, and that's called a cycle. So you may need 2 to 4 cycles before you get pregnant. So you need to know how much money your insurance company will provide you in terms of going through that process. Oh, Kim, I understand you saying that. That's why I'm here, because I want to make sure women know what their options are so they can plan accordingly. But definitely talk to your insurance company, see how much they will apply towards in vitro or fertility processes that you need. And then you can then start saving, look into options of how you can pay. Most physician offices that offer fertility treatment do payment plans. So they don't expect you to have $10,000 sitting in your savings account. They definitely do payment plans for the process, because most people, even with insurance, will need some help, because it's not just the surgery, but it's the hormones and it's the other medications that you need to be on. So right now, if you guys have questions, give me your questions, because I had another topic that I actually wanted to talk to you guys about. And so if we are good with how Hallie and Janet got pregnant, then I'm going to move on to my next topic. Okay, so I'll kind of sit tight for that. While we're waiting, I want you guys to know, if you are enjoying these talks, if you're getting something from it, please share the video, share them on your Facebook page, share them with your friends. And I am available on Facebook, on Twitter, on Instagram, even on LinkedIn. So if you want to get in contact with me in any of those times, then you can follow me as all Dr. Dawn OBGYN. If in the 40s, here's a question I got. If in the 40s, what are the best options if I didn't freeze any eggs? The first thing I would do is get in with your doctor and have them refer you to their fertility specialist that they work with, that they have a good relationship with, that they know that this specialist has a good track record, and not just in getting people pregnant, but in terms of how they treat their patients, because this is a very emotional time for women that are going through this. So you want someone who you are able to relate to, you can talk to, you feel comfortable with, because it's a very sticky situation. So I would get in with your fertility doctor, and we want you to go in, and I don't know if you were with me earlier, but there is a test that they can take that can tell the quality of your hormones. It's or your eggs, AMH, anti-Mullerian hormones. So that gives us a good picture of how well your eggs are, to see if you are still a candidate to try to use your own eggs, or whether it would be better to get a surrogate. In your 40s, let's say you're 40, 41, maybe even 42, that doesn't necessarily mean that you can't get pregnant and you can't use your eggs, because most of us haven't frozen our eggs. Most of us are in our 40s, we're like, yep, I think I want to get pregnant. So get in with your doctor, and have them refer you to a specialist. They know you're 40, so they're going to be working double time to make sure that your eggs and the egg quality will be what it is. And sometimes, I'll be honest with you, the egg quality is in between. It's iffy. It's like, well, it could be okay, maybe not. And in that case, you just have to kind of go for it and see, with knowing in the back of your mind that you may need to use surrogate eggs in the future. But if you're in 40, 42, I would still go and see, try to use your own eggs, because the rates of women being able to get pregnant in the 40 and 42 have increased because the technology has improved. So I'd say 39, 41, 42, I would still go, but get in soon. Like, don't dilly-dally, get in, make your appointment with your doctor, let them know what you're coming to see them with, and you may even ask them on the phone, okay, do I need a referral? Can I just go and see this fertility doctor? More times than not, you will, because you want everything to be paid for with your insurance company. So we have to document that we have a visit and that we found that you have fertility issues in order to get the referral to be paid for, because you don't want to do that. Pay for this all out of pocket unless you got it like that. So get in with your primary OB, have them make a referral to your fertility doctor, let them know that you're interested in getting pregnant, and they will know what testing that you need to do to see what your egg quality is. And one of the tests that they'll do is the AMH, is the anti-Mullerian hormone. Okay, so that's what I would say. If you want to be like Janet, then get in to see your OB and get in to see your fertility doctor. Because one of the things you also want to pay attention to is when you go to see your OB, they want to know the basics are okay. So you get you a pap smear, you're probably going to get basic labs and check your cholesterol. We want to have these babies, but we as physicians want to make sure that you guys are healthy. So there's some things that your primary OB is going to take care of, and labs that they're going to do, and then we kind of tag team it with your fertility doctor, and they kind of take over. And if you get a good doctor, they'll be able to kind of tailor it to what your personality is, what your goals are, and what the best option is for you for at that time. Okay? Thank you for your questions. Again, it's Dr. Dawn, Chicago's own board certified OBGYN. If you are enjoying these videos or you're getting something from it, please share the videos. Please check out my Facebook page, Dr. Dawn OBGYN. I also have a website, Dr. Dawn OBGYN, and I would really encourage you to go on the website. I have different information there. Back a few months ago, I did a series on contraception. And even though we're talking about pregnancy, contraception is important too. So I would encourage you to go to my website. It's Dr. Dawn, OBGYN. That's www.DRDAWNEOBGYN.com. And check out the website. I am offering a free audio book on contraception. So I'm kind of going through all your options of what you have for contraception. And I also have another freebie there, but you can only get it if you go to the website. So go to my website, check that out, and then we'll be good to go. All right, so now, before I had all this information from Hailey and really knew I had to talk about it, my original Facebook Live was going to be 5 reasons to see a gynecologist before age 21. So what I'm going to do is, it's 12:25, I said 12:30, so we'll kind of segue into that. And I'm going to talk about 5 reasons you may want to see your OBGYN before age 21. So a lot of us have young ladies in our lives, either our daughters or our nieces or our little cousins or what have you, and they may be they're teenagers, or they're about to go to college, or they're about to start their first job. And we kind of want to make sure that they are healthy when they start young adulthood. So I have a series I'm going to do this week. I'm going to do it today, and I'm also going to do the second part to it. I think I'm going to do that at Wednesday at about 5:30. So check me out on Wednesday 5:30, because we're going to continue this conversation. But the topic I want to talk about now is 5 reasons to see an OBGYN or gynecologist before age 21. So the first question you may say, well, why is 21 a big deal? Why are we even focusing on 21? The reason why we say before 21, because we know at 21, we know that that's the time you need to start going in to get your pap smear. Pap smear is a screening test that we use for cervical cancer. And the benefits of it is that it's a test that we use. We get actual cells from the cervix, and we can look under the microscope and determine whether these cells look like they're changing and abnormal and moving towards cervical cancer. Cervical cancer is not a cancer that moves very quickly. Most of the time, from having a abnormal pap to having cervical cancer, it could take anywhere from 5 to 7 years, maybe longer. So the pap smear is done because usually if we can catch it early enough, we can stop it before it progresses toward cervical cancer. But the reason why we won't have you do it before 21 is that we know that you may have some changes in your cervix or cells that look a little bit abnormal, but in general, before 21, they tend to get better on their own without any interventions, without us having to do anything. If we have an abnormal pap when you're younger, we can follow it up and it's gone. But what happens is, as a physician, if we have an abnormal pap and we repeat it as another abnormal pap, then we really need to do something about it. So the next step would be what's called a colposcopy. Colposcopy is when we look under the microscope, we put some solution on there so that if there are abnormal cells, we take a biopsy of those cells and we have more tissue from your cervix to determine whether the cells are actually abnormal and potentially pre-cancerous cells. So once we do the colposcopy, let's say that it's positive and you do have abnormal cells, then we have to do more testing and we may have to do a larger biopsy. The problem with that is the more testing that you do and the more tissue you take from the cervix, it can impact you when you are ready to get pregnant. So let's say you have a cone biopsy done because you had abnormal cells. We have to pay attention to you when you are pregnant because some women, depending on how many times they had the cone biopsy or how large or the amount of tissue that was taken out, you can have problems with the pregnancy in terms of maintaining the pregnancy in the future. So as a result of that, they've determined that 21 is the time when we'll start having pap smears for girls, because before that, the paps, even if they're abnormal, don't really end up being a problem. So I have 5 questions of reasons why for today that I would say, if you know of a young girl and she has any of these concerns, have her go to see her OBGYN. First one would be, we want to start early with having our girls thinking about maintaining a healthy weight and helping them to feel good about their bodies. So that means sometimes, we as family members will say, hey, I want you to go work out, or hey, watch what you eat. Sometimes it takes other avenues for them to really pay attention to that. So if you bring it into her physician, we can also talk to them about, hey, you want to think about a healthy lifestyle. You want to make sure you're drinking a lot of water. You want to make sure that you're eating healthy food. You want to make sure you're getting mostly vegetables, some protein, smart carbs. We can talk to them about what smart carbohydrates are, and making sure that you are focusing on healthy food and not the health foods that we sometimes focus on when we're younger. Potato chips, candy, cakes, things that are not necessarily good for us. We can also talk to them about pros and cons for alcohol, using too much of it, smoking, things like that. So the physician that you're working with, your GYN, can help get that woman, young girl, on the right path. And if we maintain a relationship, that might be something or someone that they really can look to and listen for advice. And the more avenues that they have to hear the right information, the more chances they have to make good decisions. So the first reason I would say is to start them early with learning about and maintaining a healthy weight and an active lifestyle. Number two I have, and this is something that a lot of my moms that call me have a question about, that when they come in, they can learn to see whether their periods are normal. So we know that our girls usually start their cycles about 13, 14 years old. But it may take a year or two for those cycles to be regular. Typically what we say is regular is something that comes every month and it lasts anywhere to 3 to 7 days. But like I said, it may take a while for those cycles to regulate themselves and what's regular for that young woman. So you may want to come in and talk about those things with your GYN doctor, just so she's assured that she is not abnormal, that she's okay, she's not worrying or fretting about something that she really doesn't need to. So we can kind of touch bases and she can understand what's regular and what will be regular for her. Because some ladies bleed 7 days all the time. Some ladies bleed 2 days. Some ladies, when they have their cycle, they may have breast tenderness, they may have cramps, they may feel bloated. And that's normal, but you need to know that. You need to know what's normal for you. And so what I like to do is sit down with my younger patients and encourage them to write a diary, write down what's happening on the days that they're on the cycle, so they know, okay, this is basically how my body works, and they're okay with that. And that's very important because that helps them to feel comfortable with their bodies, and that in turn helps them to feel comfortable with themselves. So that was number two. Number three, I will say, is to get birth control. So they can choose when they want to become pregnant and when they are, if they're sexually active, when the right time is for them. So I would like to talk to my girls before they're even on the verge of being sexually active. Let's talk about what options there are out there. Let's talk about why you want to potentially wait to have sex, and if you decide to have sex, what options you have. And let's talk about sexually transmitted infections, because if you decide to have sexual intercourse, then you're opening yourself up to potentially that. So I like to talk to my girls about their birth control options prior to the closeness of them being sexually active, because they already have thought about it. They're not under duress, so they can really take their time, get the information, and learn for them, their schedule, how they are, what's good for them. So again, in conjunction with that, if you go to my website, I have an audio book that you can listen to that talks about all the options for birth control. It'll be perfect for a young girl who's potentially thinking about that. Hey, Dr. Michelle. The fourth one I would say along those lines is, let's get a basic understanding of how to have a safe and healthy relationship with the boyfriend or your girlfriend. So let's just have an understanding of what you should be expecting, what's appropriate, what's not appropriate, not just in terms of whether you want to have sex or not, but also in terms of how you're interacting with that person, how that person is speaking with you, how that person behaves with you, how that person behaves with you when you all amongst friends, amongst others. Young people sometimes don't have positive role models in terms of what is a healthy relationship. So it's good for them to come in with a physician and talk about potentially what's going on with them in their relationships, because we know domestic violence starts early. A lot of perpetrators of violence, this is a learned behavior. So it's not that they don't know that it's wrong, but they don't see anything. They are not alarmed by it because they're around it all the time, so they've become numb to it. So this is just how they respond. So we know that perpetrators of violence either had it done to them or had it in their household. So it's just normal for them. So that when they act out and do this to their partners, this is not necessarily in their mind initially something that's wrong. That's just what we do. And we all know of couples that bicker and scream and holler and they fight, and that's how they do, but that should be alarming. So sometimes it's easier for people to talk to a stranger than it is to a loved one, because they don't necessarily have to worry about a judgment. They can just kind of speak freely, and then they can walk out the office and be done with it. So I think it's important to bring in our young girls or our young patients so that they can talk about their relationships and get an idea of what is healthy, what is safe. And if it's not safe, we can talk to them about what options they have to either get out of a relationship, and once they get out the relationship, how to make sure they're in a healthy relationship the next time. Number 5 that I have here is to get them started with taking the human papillomavirus vaccine. That's the HPV vaccine. Why is that important? And it's so interesting because I was back in residency when this HPV became more of a game changer. It's a game changer because we know that the human papillomavirus, or HPV virus, is what sets up an infection and causes those cervical cells to become abnormal. So not all infections that are started with the HPV virus end up with potential cervical cancer, but we know that there's a higher chance of you having abnormal cells that can move towards cancer if you have this virus. Now, some people have this virus, the body fights it off, and it's not a problem. But there's some people that have the virus, and it sets up changes in the cervical cells, and if we're not monitoring it, they can move towards cervical cancer. So, what the vaccine provides is immunity towards certain human papilloma viruses. So they have the top 2 to 4 viruses that cause abnormal cervical cells, and they also have the top viruses that can cause genital warts, because the human papillomavirus is also the virus that can cause genital warts. So if you start your vaccination, that means if you are sexually active, you're not protected with condoms, and you come in contact with those specific viruses, you're protected from them. So typically it's a 3-series vaccine. You get the vaccine, you can start it at 10 to 13. It's available for girls and boys. You get one, and then I want to say 2 months later you get the other one, and then 4 months later you get the third one. So you get it over 6 months, so that if you finish that series, you're protected. And if you miss 1 or 2, you can either start or do a catch up. But the purpose or the thing to do is try to get our young people in to set them up for this vaccine. And the best time for that is 10 to 13. So you may go to your gynecologist, you might go to your pediatrician, but either way, that's another reason why you would have someone come in before 21 to get checked out. So I had a lot of information for you guys, so you may have to look at this video again, that's fine, but if you find that you're getting some information or some knowledge that's really useful, please share this video, share it with as many people as you can. Like the video if you really like it, and visit my website, because like I said, the website, I have more information there. I have a free audiobook on contraception options that are really good for, even if you are already sexually active and you're on something, you may learn some information about options that may make you switch so that it's more effective to you. So This is Dr. Dawn, Chicago's on board certified OBGYN. My mission is to empower women of all ages with pertinent medical knowledge and proactive sexual education so that we can optimize your physical and mental health, improve your self-esteem, and motivate you to do more for yourself. Because I believe my motto is, when you know more, you do better. You know more, you'll be better. So that's what we're coming together for. So I'm going to end it right now. What I want you to do is come and meet me again this Wednesday. We're going to do it about 5:30, but I'll put out announcements for that. And we're going to have another 5 reasons why you may want to see your GYN doctor before 21. Thanks for joining me, guys. Bye-bye.